missing some little chemicals. So what they're doing is they're synthetically putting in replacements, to literally fill a gap, so to speak, that's been left there. This isn't actually scientifically proven yet, but that's the logical kind of hypothesis. The most commonly used is Ritalin, which is actually the company name, and dexamphetamine, which is another drug. They're both basically stimulants in high doses. The interesting thing about these psychostimulants is there actually has been no good long-term studies on the use of these drugs, which is interesting because they've been used since the 60s, so I would be hoping that they would have been done by now, but there actually isn't any really long-term correct studies that have been done to see what happens. There are side effects. I remember about 5 years ago when I first heard about ADHD, I had some patients who I'd been looking after their son, who at that time was called hyperactive, or before that time, and they came in one day and they said, look, we've decided we're not going to continue with your treatment because we've been talking to the doctor and there's this new drug, and what it is my kid's missing certain chemicals in their brain, and they're going to put the chemical in as medicine, and the good news is there's no side effects. And which is probably not very true. But in the early days, I remember some of the ads that were out there. This was going to be the wonder drug, it was the wonder behaviour drug, and they literally said that the side effects were minimal and almost non-existent. But as we'll see in a moment, there are some. And the key to understand about this is taking alone medication is often not enough to help. When you look at the conventional treatment, it should be 2 or 3 tiered in the sense that there should be, if there's going to be medication, medication is not the only thing. There should still be educational stuff. There should still be behavioural strategies being put in place. So, if Ritalin's good for kids with ADHD, wouldn't it be good for everyone? This is what they found. Researchers had long reported that Ritalin at low doses had a paradoxical effect, the opposite of what you would expect, because as we said, Ritalin is a stimulant, so we would expect our kids to be hyperactive and more ADHD-like. But what they found was that it's like speed that slowed children down. And eventually it was recognised that stimulants had the same effect on almost everyone. They improved the short-term concentration. It was just that people with ADHD needed more help focusing than the rest of us. That's from an article in the Washington Post, which is the best, well-rounded article I've ever found that really looks at all of the issues of a child with ADHD and how to survive this process. But the bottom line is that anyone can take Ritalin and feel better and concentrate better and perform better, perhaps in the workplace. It's not something that's just tailor-made for someone who has an ADHD brain. So what isn't Ritalin? What doesn't it do? First thing you need to realise that the response to medication shouldn't be used as the basis to diagnose ADHD. I've occasionally heard of this where people have said, well, they've suspected that their child had ADHD, so they've taken them to the GP and said, look, what do you think about medicating them? And the GP said, well, I'll tell you what we'll do. We'll put your child on the Ritalin for a while and we'll see how they go. And if we find that they improve, then it probably tells us that maybe your child did have ADHD. That's not true, because as we just saw, any person will concentrate better and their short-term memory will improve with taking Ritalin. The other thing is Ritalin and other therapies may correct classroom behaviour problems, but there is no evidence that this improves a child's academic performance, and this is from that same expert panel. And this is a really controversial one, because parents always say to me when I bring up this slide that, but as soon as my child was on the medication, that the teacher was saying that he was doing better in the classroom. I even saw his handwriting. His handwriting used to be scritchy and scratchy, and now he can write, nice script. That's probably true. It's a behavioural thing, though. We know that it improves behaviour, but we know that it doesn't actually improve academic performance. It doesn't increase your IQ. It doesn't, improve your ability to learn or to achieve in an academic situation, or even a career situation. It doesn't make you. It's not a smart drug. It's a behaviour drug. So it's important to understand that it's a bit of a myth almost that's spread about the Ritalin. Oh, my kid's doing so much better in school since they've been on it. They're behaving better in school, but they're not performing better in school. They may just be actually learning something. which most kids are supposed to do. So as we said, there are side effects as much as they were suppressed in the early days. As I said, it was almost initially marketed as the drug with no side effects. But here's the list. Weight loss, we see this a lot in kids. You really see them trim down when they start on this medication. Sleep disturbance is very common for kids to have their ability to get to sleep, and their ability to stay asleep is quite affected. Fast heartbeat, high blood pressure, chest pain. These are in decreasing regularity and amounts of people that would get these side effects. Chest pain, fever, joint pain, skin rash, hives, uncontrolled movements, black tarry stools, blood in the urine or stool. So bleeding basically within your child's body. Changes in vision, seizures, cramps, bleeding or bruising, mania, insomnia, hallucinations. Here's the ones I like: hyperactivity, impulsivity and inattention. Isn't that a good side effect to get if you've already got inattention, impulsivity and hyperactivity? What a bonus. Psychosis, delusions, depression, dizziness, nervousness, irritability and attacks of Tourette's or other tic syndromes. Does everyone know what Tourette's is? You know, we've all seen them on the TV shows. They always seem to have a character on the American TV shows who's got Tourette's. You know, they usually have a tic of a physical nature, and they usually have a tic of a verbal nature. You know, they can be quite outspoken at times. The key thing to understand about a child, if your child is already showing characteristics of Tourette's, if they already have a bit of a tic, if they already have some verbal outbursts, then they're the kids that are the most at risk of getting a full-blown attack of Tourette's if they're given Ritalin. You know, it's literally like potentiates and causes it to happen. So it gets pretty scary. I mean, obviously not every child's going to get these particular things, but there are percentages of children who take these medications that are going to show these problems. Ritalin should not be used in children under 6 years, since safety and efficacy for this age group has not been established. They haven't studied the way that this drug works in children's brains under the age of 6. Sufficient data on safety and efficacy of long-term use of Ritalin in children are not yet available. These are basically off the medication, you know, the little sheet that you get when you get a medication. So that's a scary thing, that a lot of kids are almost being set up and said, well, this is your drug and this is what's going to take you. It's like having diabetes, you know, you need insulin. You have ADHD, so you need Ritalin, and you're going to need it for you know, X number of years. But it's a little bit scary because we don't have long-term studies looking at the effects of how these work. Another thing you need to be aware of is how Ritalin works with other medications, because they can be quite horrific or dangerous. Caffeine is a key one. What caffeine does, if you can imagine, you know how caffeine's a stimulant. We all know that because, you know, we all use it at 8 AM to get going, right? And we know that Ritalin's a stimulant. So you would think, let's say we have this much Ritalin and then we add this much caffeine, we would think, well, they've got that much stimulant. But what caffeine does is it increases the effect of Ritalin. So you get this much Ritalin and then you add in this much caffeine and it does this. Okay, so that's literally the interaction between caffeine and Ritalin. You're literally changing the dosage that your child's getting. Asthma medications. There are certain asthma medications that in certain kids, if you mix the two, they are literally toxic. You know, they can actually have an anaphylactic reaction and die from this sort of a mixture. So if you have a child who's on asthma medications, it's vital that you make your GP or the paediatrician aware of this, and you get them to look in the book and make sure that that drug is okay to mix with Ritalin. Cold, sinus, hay fever, allergy medicines, most of those have pseudoephedrine, which is a stimulant. Okay, so you're talking about that same effect of caffeine. So it's very important that you probably avoid your children ever taking these if they're taking Ritalin, because you'll occasionally see some weird and wonderful reactions going on in their behaviour. Obviously amphetamines. This is really key for those of you who have teenagers, you know, and kids who are getting into the more socially active time. It's really important that they understand that if they're taking their Ritalin and they go out to a party and they start playing around with some new stuff, they're going to get some very dangerous and weird and wonderful reactions going on, which they may think is good initially, but you know, they are potentially life-threatening. So it's really important that teenagers understand that they shouldn't be mixing their medication with their social activities.